episode of WorkComp Talk. I'm your host, Carmen Ramirez, and today we are going to dive into a very, very touchy subject. I know that a lot of you guys have been watching the news, and you already know that here at WorkComp Talk, we try to talk things that are going to relate to our community and those surrounding us as well. So, in the news lately, I have been seeing a ton of information in regards to the LA wildfires. And I just put myself in the shoes of someone who lives in the vicinities of those wildfires. And it's a scary situation. I recently, before they were trying to shut down TikTok, was actually able to see a lot of TikTok videos where people from the community were trying to put their part into making sure that people's homes were not burnt and their homes as well. So one video really stuck out to me, and that was essentially a family who stood out there in the freaking thick smoke, just trying to drain and drench their house and drain their pool so that they can have as much water in their house and it wouldn't catch on fire. So, what better than to join us in this episode is a doctor that has to do with lungs, because of course we're going to have a lot of questions related to the air, related to the smoke, related to the toxins, related to everything that is happening here in California. So I'm excited that we get to have Dr. Nee on this episode. How are you, Dr. Nee?
Very good. Happy to be here. Thanks for having me.
We're excited to have you here again, because if you guys don't remember, she was actually on our podcast in the beginning of the COVID stages, which she also shared a lot of information. If you want to go check out that podcast, you can do so in the link in the description as well. And I get Bilal back. Yes. He's been MIA, but I'm super happy to have you back. Bilal, how are you?
I'm doing well, man. How are you?
I'm doing good. Missing you, of course. The podcast is kind of solo. The last episode I just did, it was a solo episode, which was really, really good as well. But I'm excited to have more than one person to have this conversation with, because I know you guys have seen the news. The wildfires are very, very sad. And it's something that's affecting not only people in Southern California, but essentially all of California. When SoCal burns, it hurts us to see how this community is falling apart. I know we saw it here with the Paradise fires not that long ago, and we saw an entire city just go to ashes. So, of course, in the community, there's a lot of people trying to put their part, and a lot needs to be talked about in regards to what's in the air. So, I kind of wanted to jump into this podcast and definitely touch in the subjects for those people that are close to us in SoCal and are living in the area. What's to expect when you go out? I know we see it on our phones. It says unhealthy air. What does that actually mean for someone? Amy, if you can answer that.
There is a categorization scientifically of the degree of air quality. I mean, sometimes you can see it specifically on your weather apps, whether if it's pollen, dust, and other particulates in the air. But particularly, there's a scale called the AQI, which kind of in general measures the amount of pollution in the air. So usually warnings go out when the higher the number, the poorer the quality of the air. So typically when we do see these warnings, it's usually aimed at people who are typically more vulnerable, like those with chronic heart or lung diseases, young children, women who are pregnant, the elderly, etc. So usually when you see an air quality of greater than 100, there's kind of like a warning, be careful. And then when it gets really bad, the AQI would usually reach about 200. That's usually typically what you see when we have these very bad air days with fires in California.
So what are some of the long common issues that happen, related health issues that happen when there are wildfires and these numbers are hitting that 200 range? Like, what do we see there?
Yeah, so, it's an interesting kind of group of research that's happening for, a very long time, and now more relevant than ever. But we do know that there are short-term as well as long-term consequences to poor air quality, particularly with wildfires, where research has shown to be even more toxic than what we think of typical air pollution, like from manufacturing, car pollution, things like that. mostly because the way that the fires burn are at a much higher temperature. So the toxins that are released have more damage or stress on the body than ones you would see like from coming from factories or cars. So in terms of short-term damage, what we see a lot, and I do see a lot in our lung clinic and the hospital, is people who have asthma, people who have smoking-related lung disease like COPD or emphysema. They often are the first type of people that are at risk during these wildfires. They would come in with acute flare-ups of their disease, so which would usually present as cough, shortness of breath, difficulty breathing. Um, and the long-term consequences, I think we're still kind of beginning to understand. One particular example that I always remember is, after 9/11, with the type of lung injury and cancers that develop in the firefighters that were working on the site. That's an example of an extreme short-term exposure of these type of extremely high temperature fires that can produce. But definitely, I think the majority of the issues that we do see are these acute exacerbations of asthma and COPD.
So you mentioned about the firefighters related to the 9/11 incident, and this was despite them wearing their like protective gears.
Yeah, I mean, I think I would assume that in those moments, I'm sure there are protective equipment that can protect you to some degree, but perhaps there are still unmeasurable amounts of toxins that can still get through, these situations, or maybe in the stress of the situation, you aren't maybe wearing the protective gear
Right.
100% perfectly all the time.
100%. I could
Yeah.
totally see that.
Dr. Nee, I have a question
Well,
about that. Actually, I've seen in the news people are walking around trying to either go back to their homes or even influencers who are just driving around trying to capture footage of these fires and stuff. And they have things like towels wrapped around their face or like a t-shirt pulled up over their nose. I mean, is that really going to do much, if anything, to prevent lung injury?
Yeah, the real answer is probably not. These sort of not basically anything other than N95, which is has been approved by the NIOSH kind of organization, aimed at particularly filtering out a specific particle size that can cause all these damaging things to your body. So things like bandanas, even a surgical mask, is going to not be able to protect you adequately from these microscopic particles. Yeah, to some degree, it might be able to protect yourself from these large particles, which for the most part, your body, if you have normal lung protective systems, can filter out a lot of these large particles. What we're really worried about is these tiny microscopic particles, which everyone, if you're in that environment and have to be there for a particular reason, should be wearing N95 for sure.
so that was going to go to my next question about the N95 masks. Like, what about the people that are living in the surrounding areas and they're using like these air purifiers and stuff like that? Like, how effective does that come into play?
Yeah, I think air purifiers are actually pretty good. And it depends on how you use it. It's the exposure and pollutant, it's all about the amount of pollutants that you get exposed to and how to dilute it as much as possible and filter it as much as possible. So for example, if you have your room with the windows open and all the pollutants are filtering in at a high degree, perhaps no amount of air purifier is going to be able to filter out all the air. So in those situations, using HEPA filtered air purifiers, having your windows and doors closed, if you have the ability to have filters in your HVAC system that can help filter some of those as well. So all those things can help, but it won't help if you have your doors and windows open.
Right. There's a lot of there's just a lot of people exposing themselves. Like Bilal, you mentioned earlier, the influencers. I mean, I'm just thinking about like the news reporters and such, right? Yeah, they're carrying their N95 masks, but as they're doing these reports and stuff, they are exposing themselves to these toxins. And from things that I've seen in the news, they really talk about, even after the fire's put out, there's still a lot of stuff happening in the air, and that people go back, like Bilal, you mentioned, people go back to kind of try and salvage anything that they can from whatever rebel was left from their homes. You know, it's these little amounts that, Dr. Nee is mentioning, that even the littlest amount, because it's a different type of, I'm assuming, toxin, and God knows what else is in the air that's in these people's houses, that can affect people that have issues, or maybe not, right? It's people that are completely healthy. What are some of those symptoms? Like, say if I were to go up there and like wanted to shoot some video, I don't have asthma. I want to think that I have healthy lungs. What would be some of those symptoms that I would breathe on and catch on and would be like, oh, dang, this is bad?
Yeah, I mean, even people with healthy lungs, you may get, temporary discomfort, cough. Sometimes we see with people with healthy lungs, even after getting a really bad cold, you can have a lingering cough even for many weeks at a time. And that's basically your body's immune response getting a little hyperreactive to whatever inflammatory damage that's happened, whether if it's from a virus or exposure to air pollutants. So you might have temporary cough even for days sometimes after the exposure. And then again, the key question is, how do these intermittent but significant exposures to wildfire smoke or any other smoke cause long-term damage? And I think that's something that is still being researched. As you can imagine, any sort of gold standard research requires having a group of identical people exposed to the exact thing and then not exposed, and then kind of compare what happens after. And in these type of situations, it's really hard to do that experiment, or nearly impossible. So what we have is a lot of these observational studies where we look at, maybe in the pregnant population, what happens to their birth results when they are living in those environments. So we're just beginning to understand the long-term effects.
Yikes. I mean, for all those women that I see on TikTok that you guys are pregnant, you're complaining about the air when you take your kids to school, please make sure you guys, I'm assuming, could at least wear the N95 mask, right? It's kind of helping a little bit more than just going bare like, hey, let's go to school, kids. Speaking about pregnant women and obviously the schools surrounding the areas, how does this really affect the kids? We know as adults and people that do have, lung diseases or that have asthma or other related illnesses, how does this look for a parent that takes their kid to school still and they're being exposed to the smoke?
Yeah, I think the younger the children, their immune systems are still developing, their lungs are still developing. So I think it definitely, younger children is included in the more vulnerable population, especially, kids have asthma at a very young age too. So those are kind of the most sensitive group that should be definitely careful and protected. One thing I would say for everyone, whether if you have children or not, is to keep close connection with your doctors. Make sure you have a plan ahead of time. Like if you are living in an area where there's wildfire, make sure you talk to your doctor before these things happen. Bring it up proactively so that if it does happen, you know what to do, what to look out for, and have medications ready, for example.
Right. I know in the past, the episode that we had with you, Dr. Nee, you explained how COVID would essentially attack the lungs and how it would just kind of just go in there. For the sake of this podcast, what happens to the lung when you breathe in all of the smoke and these things in the air?
Yeah, it's actually really fascinating. There's a lot of things that you can sort of see and also not see depending on the size of the particles. So your body has a pretty robust protective system for these larger particles. The mucus and the cilia, or the tiny little hairs that we have beginning in our nose, beginning in our nostrils, it kind of extends down pretty far into the larger airways. And those actually are the primary defense mechanism for catching these larger particles. And then the cilia actually help moving them out of your system. So you sneeze, you blow your nose, and a lot of it comes out. What's really dangerous is like eventually you'll get these microscopic particles that will bypass these protective mechanisms, and they'll eventually end up very deep in your lungs in the alveoli, or the little microscopic anatomical parts that exchange gas. And then they could actually go into the blood vessels, the tiniest of blood vessels, and circulate into your bloodstream. So this is where a lot of the molecular studies are done, which show that as soon as those events happen, your body start producing a lot of high inflammatory molecules, signaling that your body is feeling the effects of it. So that's part of the mechanism of potentially where cancers can develop, infections can develop, and other inflammatory conditions.
Dang. I mean, I totally understand the hairs in the nose. A lot of the times people kind of, take them out or they wax them out. Like, this is our built-in filter for
Yeah.
our own body. They say that our eyebrows are actually meant for us to hold the sweat for it going into our eyes. The eyelashes are also protecting the eyes. And so are the nose hairs. What happens to people that shave or wax their hairs?
I would say anything on your body that you're born with has a purpose. So try not to pluck all of them out. But, honestly, I think if the people that do those manicuring things are probably okay. You're not going to be plucking out, 100% of your protective
Right.
nose hair. So it's probably okay. But, like your eyelashes and your eyebrows, they all have a purpose to protect your eyes.
Yeah. Tying into what you
100%.
said, Dr. Nee, about long-term potential for cancer, in the work comp world, there's a presumption for firefighters who develop certain types of cancers, and that's primarily based, I think, on the long-term exposure to things being burned. Whether it's natural or it's human-created compounds and such. I think we see it a lot in our work comp world, where there are firefighters who develop a lot of cancer when they've been on the job for 10, 15, 20 years, from responding to structure fires or wildfires continuously throughout their career. I think it's unfortunate because just more and more we see there's more and more fires that are out of control. And you see on the news, the firefighters are out there still fighting the fires. And most of the time, at least the footage I've seen, they're not wearing respirators. They're not wearing a lot of masks. There's the prison crews and stuff that are out there who are digging up brush in the smoke and whatnot. And it's really sad because I think the long-term effects aren't necessarily appreciated in the moment. And, it's probably something we're going to have to deal with 10, 15, 20 years from now.
Yeah, absolutely right. I mean, I think unfortunately, the firefighter cohort population is kind of like an extreme example of these type of exposure, where someone is day in and day out constantly getting exposed. So it's we can extrapolate that group of people and kind of put it into our general population. As the more we see, the more wildfires we see, we can probably expect some of these similar consequences for the rest of us.
Damn. I was reading an article not that long ago, and in particular to the firefighters and being surrounded by all of the smoke and just the nature of the job. And I want to say I read that at least in the higher 80% bracket of firefighters do develop cancer in that career. So that's like scary. But what does that mean for, say, my husband's been out there working for a month, he's been putting out these fires, and then he comes back home? Do any of those toxins travel with, even despite you taking showers? Like, how does that work?
Yeah, I mean, I think in general, if you continue to be in that environment that keeps putting out those pollutants, you will be at risk. But as soon as you kind of step away from that environment, the risk is probably very low or none at all. Sure, you might carry a little bit on your clothing, but they don't, they're going to eventually evaporate or dissipate. And it shouldn't whatever you have been exposed to most likely would have been inhaled into your body at the time that you're in that environment.
Right.
So I don't think there's much of a risk for like the family members surrounding the person exposed. It's really about the how much ventilation you have and how much concentration of the pollutants you have. So as soon as you step away from that area, typically the risk is much, much less.
Interesting. Is there any like evidence that links wildfire smoke or exposure to an increased risk of diseases like, I don't know, lung, like pneumonia and stuff like that?
Yeah, I would say by like secondary connection for sure. Any of these pollutants, like we mentioned, with our natural protective barriers, at some point these barriers they can get oversaturated or damaged or inflamed, and they can be at risk for not functioning as they normally would. So even with a normal lung, if you get super exposed to these, you're causing inflammation to your lungs and putting that lung at risk for unable to protect itself from normal bacteria that are just kind of in the ambient air all the time.
Right.
So definitely, I think there will be a risk, particularly for people who already have injured lungs or chronic lung disease.
Right. How fast does this, affect the people that already have certain diseases with their lungs? Like, if someone lives near the area and obviously they're doing everything they can to protect themselves, having the air purifiers, making sure they have the filters and making sure their windows and they're staying inside, windows and doors are closed, like, but you are really at risk because of the diseases you're already carrying in your lungs. How soon can you see that affect you? And if so, what would be like some of those symptoms? Would they start coughing? Is that an indication that like, okay, I really need to figure this out and go see a doctor?
Yeah, I mean, it could be very, very fast, very immediate, depending on how much they get exposed. So obviously, we can't have everyone live in a bubble in those times. At some point, you have to be able to go out or interact in the environment. So, the best you can do is do all those protective measures. But if you have to go out and you get exposed, in the worst case scenario with those with severe lung disease, they could be immediately affected. So the symptoms would be, for example, if you have severe asthma, you would start having more mucousy cough, shortness of breath, or wheezing. That's beyond what your normal day-to-day symptoms are. So once you get to that point, that's where you need to have sort of an action plan, after talking to your doctor, in case those things happen. Within a day or two, what do I do? Within 3 days, if it doesn't get better, what do I do? And then within 5 days, what do I do if it doesn't get better?
Would the inhalers come in and help a little bit, alleviate it? And if you don't see that doing anything, then keeping an eye on it, like
Yeah,
that.
yeah. Having a clear idea of what inhalers or medicines you're supposed to be taking, not skipping any of the doses without talking to your doctor. And then, like I said, having a plan for if things do get worse by, 25, 50%, what to do, what are the additional inhalers you can take, and then definitely when it's time to call the doctor. And also, when is it time to go to the hospital too, to understand when that needs to happen.
What if we reverse the papers in this sense? Again, everyone loves TikTok, loves Google, self-diagnose. So say I'm going out there and I'm like, you know what? I'm going to be the smart person and I am going to self-medicate these inhalers and I'm going to start taking this because I start coughing and I know I'm going to be out there. How does that look like for someone who doesn't have asthma and I'm taking all these things to kind of sort of protect my lungs?
Yeah, I mean, with taking any medication that you're not prescribed for, I would say that there's always side effects that you can have. In general, depending on the type of inhaler that you use, short term, you may have intolerance to it. You may actually cough more if you aren't given the right medication or you're taking something that you're not supposed to. And then long term, there could be side effects, especially with ones inhalers that have steroids in it. So I would definitely advise not to do any sort of preemptive treatment without talking to your personal doctor.
Wow, that's a lot of information. And I think sometimes we don't even think about this as we're watching the news. We're just seeing, like, oh, a lot of the critics have mentioned, well, it's billionaires losing houses, like they'll just build one right back up. And it's not even about that. It's a life-changing experience. A lot of these people, I'm assuming, are going to develop chronic issues that they had no idea that they didn't even have it prior to these fires. And because they were exposed to all of this, it's going to trigger something that's probably not going to be um, going away anytime soon. So I'm really excited to be able to have you on the show again and answer all these questions. As dumb as they sound, it's information that we love to put out there and have these really true discussions that are going to benefit people that are out there, specifically, the families that don't have Medi-Cal, that don't have doctors, that don't have anyone to go ask these questions to. And I'm sure, Bilal, in our industry with the workers' comp, we see a lot of the firefighters as well. We hang out with a lot of the firefighters. Shout out to Oakland Firefighters, my boy Nate. Um, it's just things that at some point still come into our everyday lives, especially here in the law firm with us. So, Bilal, do you have any other questions on behalf of the firefighters? I mean, I know you've seen cases with our firefighters. I know there's probably some of our friends working out there as well. What are some of the questions you would want to ask a doctor if you were in that situation?
Yeah, I mean, I think a lot of the cases we get specifically with firefighters and cancers, they can't point to a particular incident. They can't point to a particular time.
Yeah.
They've responded to 500 structure fires where there's rubber tires burning, there's asbestos in a building that's collapsing, and yeah, they wear their respirators and gear while they're fighting an active fire. They're going into a structure and stuff like that. But in the aftermath, sometimes not. Sometimes they don't have time. Sometimes, they think the fire's done with. There's still smoldering rough, rumble there, stuff, that affects them. And not just the firefighters too. There's Amazon delivery drivers out there right now still hustling around Los Angeles doing their thing. UPS guys, landscapers, construction workers. There's all these people out there just trying to get by and do their thing. And I think no one really thinks about the long-term consequences of it. And so, I would just say be safe out there. We do have workers' comp benefits, when people do develop lung disease, when people do develop, occupational asthma or cancers in the long term. But I think the best thing you can do is take care of yourself and be careful, and limit your exposure as much as possible. I did have another question for you, Dr. Nee. Is there any overlap between people who don't necessarily have, pre-existing pulmonary disease, but they do have, for example, allergies? Is there any heightened risk or issues that you see in your practice with people who have allergies and exposure to fires?
Yeah, I would say a little bit of that is true. When you have a wildfire, you sort of release a bunch of things into the air that normally would not be exposed or even flammable. So it's really hard to measure what are the allergens that are kind of exposed in the environment during such a fire. But presumably, if someone with known allergies to different substances go into an environment where all of those different toxins are released, they could definitely be affected. The interesting thing about allergens is that, it's sometimes with particular people with specific allergies, they're actually allergic to specific things. Mm-hmm. So how does that get affected when those allergens are exposed to fire? Perhaps it's worse. We don't really have that exact science, but I think if you are an allergic person, your immune system is already primed and in a way kind of hypersensitive to different things in the air. So definitely, I would say you might get a little bit more allergy flares if that happens.
Yeah, I could see that happening. You're already sensitive. Well, there's a lot of information out there. I would highly suggest anyone watching this podcast, if you have any future questions, to just make sure you reach out to a doctor. You can obviously, if you're not feeling well, make sure you take that, that next step and don't just wing it out and be like, I'll be fine. It's the coughs, right? The coughs that are going to essentially kind of signal you like, hey, it's not going away, or the mucus that's starting to build up for those that have asthma, any other symptoms that we need to watch out for so people can actually take action and not just wing it out.
Yeah, definitely don't wing it out. I think it's better to be overly cautious and have a plan than not. I think as a physician, I always appreciate when patients reach out to me early on, say, "Hey, what do I do if I have these things?" So that we can all work together as a team to protect everyone. So cough, difficulty breathing, shortness of breath, a change in the amount or consistency of the mucus. So sometimes people may have a chronic cough related to their lung disease all the time, but I guess to be aware of how that changes from your baseline, from your normal. With someone who has COPD or emphysema already, they're on a low amount of oxygen normally, but suddenly now it's ramping up. They're seeing that their oxygen levels are lower than normal. So all of those things are some things to watch out for.
When you talk about oxygen levels, I know we're mainly focusing on lungs here, but is there any risk for issues with brain damage, or people, if they're getting lightheaded, they can pass out, can smack their head, any long-term consequences as well?
Yeah, I mean, I would say if you're getting lightheaded because of oxygen being low, that is a dangerous kind of situation where you need to be going to the hospital. For the most part, um, you know, I would say it's more of a cumulative thing. So if you're constantly for weeks, months, or years having oxygen that's lower than the safe level, it could definitely cause damage to not only your lungs, but also to your heart as well. Brain damage, what we see is sort of these acute episodes where someone who had a stroke, where suddenly the brain has lost a significant portion of the oxygen that supports its health. So I would say short term, probably not a lot of damage, but it's these cumulative low insults over many weeks, months, years, where it actually more so affects your lungs and heart rather than your brain. But if you're to a point where you're about to pass out from low oxygen, that's 911, like hospital time.
Mm-hmm. You mentioned obviously the oxygen as well, which brought up another question for me. For those that are already on say, like a low number for oxygen on an everyday life, and then being surrounded by wildfire smoke for the amount of weeks that these fires have been burning for, and then they having to just bring it up a little bit, will that ever go back to normal, or will some people have lingering effects?
Yeah, that's a good question. It depends on the cause of their underlying lung disease. So a lot of times, if you have COPD, emphysema, or asthma, or more so the emphysema type, where that's the people who are at risk for needing oxygen. If you're going into a flare or an exacerbation, sometimes we can see the oxygen transiently go down, and it tends to recover with the treatment for the exacerbation. If you have other types of lung disease, for example, interstitial lung disease, lung scarring, things like that, sometimes these bad exposures can cause a flare that may lead to more permanent issues, permanent damage, or a flare of inflammation that ends up developing into more scarring, which are then more permanent. So, those diseases are more on the rare side in the population, but more so for those with emphysema, for example, you might see flares, transient low oxygen, hopefully improve. But we do know that when people have flares, you may never recover 100% of your prior capacity. So we always see some recovery, depending on the severity, but maybe you recover 95%, maybe you recover 90%. And the goal is really just to prevent those flares from happening.
Yeah, for sure. Well, this has been a lot of information, and I'm sure there's a lot of questions that we're leaving out on the table as well. But I definitely am excited to have had this opportunity to connect with someone that can kind of help us better understand what the fire is causing to certain people that are working out there, the lungs, and not just the people that are working, the people that live in Southern California as well. Um, I'm really appreciative of this conversation, and I want to thank you for your time. And Bilal as well, thank you for joining me and making this the podcast that we had set to be, which was to reach out to the community, have conversations that are related to things that are surrounding our communities as well. And, we do hope that the fires go away soon. But for the meantime, there's a lot of information in this podcast that kind of helps you kind of stay a step ahead of the game, especially to those that are living in the area. And I hope you guys take that information and do something with it, share it. Make sure you let your loved ones know that, yes, having an air purifier in the room might help a little bit. So if you need to just share this information, please make sure you do so. Bilal, do you have anything else for Dr. Nee?
I think we covered as much as we can. I'm sure we could sit here all day talking about it, but
Agreed. So thank you both for this episode, and we will catch everyone on the next episode of WorkComp Talk. Make sure you hit that subscribe button. Make sure you hit the notification so you get that notification that we've actually created a whole new episode for you to dive into. All of the stuff we've discussed and all the links that we've discussed in this podcast will also be on the description below. So make sure you check that as well. So thank you guys. Enjoy the rest of your week. I will see you guys soon.
Thanks, guys.